Hey Steve, how you doing today?
I'm doing good. A lot better now.
Mm-hmm. Better?
Yeah, yeah. I almost didn't make it this time.
Yeah.
I've been messing with this alcohol too long. I gotta get my act together.
Yeah, that was a really scary episode you had before you came in here, huh?
Mm-hmm. Yeah.
I mean, you almost died.
Yeah.
How confident are you that you're going to be able to stay sober when you get out?
Well, I better stay sober this time because it just keeps getting worse. I keep thinking I can't toy with it anymore. So I'm gonna have to take advantage of supports, and I'll do good this time.
Mm-hmm. So where are you going to be living when you leave?
I'm hoping to go back with a girlfriend that I've been living with for off and on for quite some time, and she thinks she believes me that I'm gonna do better this time. She's gonna give me one more chance.
Mm-hmm. So she supports your
She does.
recovery.
Yeah, and she's expecting me to do things that I've been avoiding, like going to NA or AA and getting counseling and going to church. So I'm gonna do all that stuff.
Mm-hmm. So you're going to make use of supports.
I am.
Uh-huh.
Yeah, I'm gonna do it this time.
The last time that you were here, did you not make use of supports?
No, well, I tried for a bit, but then I didn't like it, and so I took off, and I didn't really stick with it that long. I'm going to try to stick with it this time.
Mm-hmm. And what didn't you like about?
Well, I don't like people going on and on about their stories. It just makes me want to use, so that kind of thing. So I guess I was focusing on that part of it, and it seems like it's just better if I just decide not to do it, but then I do keep going back and getting hooked on it again. I guess I'm going to have to try to stick with meetings. That's probably my best bet, even though not crazy about them.
Well, wait. So you're saying that when you went to meetings, it didn't help you?
Well, no, not really.
Mm-hmm. And that actually going to meetings made you want to use more?
Yes. Yeah.
Mm-hmm.
But I don't know. What else could I do other than meetings? That's what everybody says. Go to meetings. So.
Is there anything that you've ever done that you think did help you to stay sober?
Well, I used to be much more into staying fit and exercising, and I kind of let a lot of that go. I wasn't taking care of myself. So getting a good routine for staying healthy. Probably should go back to church, get some good morals, stay away from bad crowd, stay away from the party scene.
Mm-hmm. Has church helped you in the past?
It has. I've had good periods with it, but then I get mad because people seem judgmental a lot of the time, and they just sometimes I feel like I can't really relate too much to people at church. But if I meet somebody every now and then. I've been at churches where I meet maybe a couple cool people, and I always seem to kind of get disappointed or disillusioned or something, or anger always seems to creep in there at some point.
Mm-hmm. And is anger one of the precipitants for your using?
Yeah.
For your drinking?
Yeah.
Yeah. So if you get angry.
Yeah, probably I probably should definitely do an anger support group of some kind.
Do you think that would help?
Yeah, that would probably help. I've never really done that.
Okay.
But yeah.
So it sounds like, you would like to have on your plan an anger support group. Maybe we could help you find one and make a referral before you go if you want.
Okay.
Sounds like you want to go back to church.
Yeah.
Any other supports you think you?
Well, my girlfriend can be a good support, as long as she doesn't get to nagging me, stuff like that,
Mm-hmm.
That always gets me. She can start, watching me like a hawk, and then I get irritated and start kind of trying to control my every move. Hopefully it doesn't go that way.
So it sounds like sometimes that relationship is good, and but that there are moments in it where you get angry, and does that lead back to your drinking again?
Yeah, it is a hard relationship. I mean, she can be supportive, but then she can be really controlling too at the same time. So when she gets like that, then I tend to just say screw it, and try to tune out. So yeah, it can be that relationship can be a problem. Mm-hmm. So it's a bit of a risk, but at the same time, when it's good, it's good. So I'm hoping, I won't get into that negative pattern again.
So on a scale of 0 to 10, with 0 being you're absolutely certain you're going to relapse, and 10 being you're absolutely certain that you're not going to drink again. Mm-hmm. With that plan, going home to live with your girlfriend, maybe going to an anger management group and going to church, with that plan, how confident are you that you'll be able to stay sober? 0 to 10.
Yeah. Well, my track record isn't good, but it's I don't know.
Can you put a number on it, 0 to 10?
Okay,
now?
let's say 50-50, 5.
Okay.
Realistically.
So that's okay.
I mean, I know I'll do good for a while, but it just seems like something always comes and gets me, and then I just get back into the negative thinking and drinking, and then it keeps getting worse. And it's hard to say with my track record that I won't go back, but I'm certainly going to try not to.
Mm-hmm. So can you think of any other possibilities of where you could go after you left here that might be better? I'm asking whether you would consider maybe going to some more treatment, something like a residential treatment program where you could live there and there would be, group supports, right, available to you.
Well, yeah, I mean, I'd be willing to do that if I'm going to try all these supports that you're suggesting, and I would say, if it's not going to be long until my girlfriend, she's not going to put up with anything. So I'd be willing to do that if I start to slip. But I'd like to have one more shot to do it right this time, do all the things I'm being told to do.
So I'm a little worried about 50%. So you almost died.
Now you're just sounding like my girlfriend. This is what is this? Come on.
What am I saying that sounds like your girlfriend?
Just nag. I mean, you're just saying give me easy answers, and you're just saying just look at the positive side and just tell me what you want. What I want to hear. So that's just. You just want me to tell you what you want to hear. I'll just be honest with you, 50-50,
No, I really do appreciate your honesty. I really do want you to be honest. And I hear that it's a little bit frustrating for you to have somebody sort of pushing at you a little bit.
Yeah. Well, you just seem like, you're just trying to get me to go to another program, and I'd like to tell you, I haven't had luck with programs. I don't think half the workers that are in these programs even want to be there. They all seem burned out to me. They go off and sit in the office and just leave us to sit here and stew in a room, and you just want to seem to want to push me into that kind of thing, and I don't.
Yeah, it feels to you like I'm pushing.
It does. Yeah. So.
Okay, so I want you to know that it's entirely up to you what you do.
Well, what are you going to do? Cab me over there?
No. So. What I was thinking of is you and I can go over to the program, and I'll go with you. We can meet the staff. You can hear about what it's like, and then we can have another conversation like this. And I want you to know that it is totally up to you what you do. I just would like...
You're saying you're going to go with me?
Yeah, I'll go with you.
Baloney. You're not going to go with me.
I'm going to go with you. I absolutely mean that. We're going to call the program and find out what time is good, and then I will go over there with you and we will look at the program together. And then we'll talk about the pros and cons again. I'm concerned that 50-50 isn't enough chance, but you have the right to take that risk. It is your life. You have the right to take that risk. What I'm suggesting is before you take that risk, you explore another alternative in a little bit more depth and see you know, I'm going to show you a specific program, one that I think is really good. You may not, and that's okay.
I still can choose.
But yeah, absolutely you'll get to choose. I absolutely promise that it is up to you what you do. I would just like to have, for you to give yourself the opportunity.
And you really know this program, you know people in the program?
Yeah, I do.
How do you know it's a good program?
Well, I've referred other clients, many of whom are now in recovery. I know the staff over there, so it's a program I know a lot about. And they've had some really good success with people who seem similar to you, people who've, you know, with alcohol problems, who've relapsed a number of times. They've had some really good success. And, you know, from my point of view, at least it would be good if you looked at it and thought about it. And you know what? If in the end you decide not to do it right now, you know, before you said, you know, maybe if you went with your girlfriend and you failed again, that you would be willing to go to a program. So even if you don't go now, then at least you would know what that program was like. And so if you got to a place where you were ready to go, you would at least have a program that you know about to go to, rather than, you know, get into that, you know, relapse place and not even know where you could call. So
well, this is the first time somebody's offered to actually go and show me a program, so I'm not gonna promise anything, but show me your program. You know,
okay,
I'll go.
Great. I'm gonna call them and see if I can get us a time to go over. Okay?
Okay.
Thanks a lot, Steve. I have a lot of respect for you. I realize that it's really important to you that you get to make your own choices, and I want you to be able to make your own choices. And, you know, so I totally appreciate your being willing to at least look at another option.
Okay.
Okay. This scenario demonstrates trauma-informed discharge planning. Notice that instead of telling Steve what his discharge plan should be, I explored with him his own confidence in his ability to retain his sobriety and connected that to different supports that he thought might support him in being able to do that. The plan for this role play was that Steve was supposed to get angry, and then I was supposed to handle that. It was difficult when we were actually doing it for him to get angry because there wasn't much to push against. However, I was able to, with some coaching, get him to do that. When he did become angry, then I used my own self-regulation skills and explored with him what the anger was about, and that seemed to help him to settle and to be able to move on. In moving forward, realizing that disempowerment was a lot what he was concerned about, I was able to emphasize repeatedly his power of choice and that I wasn't going to make him do anything he didn't want to do. Often, clients in discussing their discharge plans will simply comply with what the provider says, and then they'll fail to follow through. It's more effective to help the client to explore their ambivalence so that they're aware of both the pros and cons of what they're deciding. In that way, when they finally get to a decision, they're more aligned with it and able to follow through. In watching this video, there was some concern on the part of some providers that my offering to take Steve to the program was enabling. However, this is what we call making a robust referral. Steve is a trauma survivor, and he has difficulty with trust, and he may also have difficulty walking into a situation when he doesn't know what to expect. So I use the safety of our relationship to help him to make the transfer to another program, using that safety to make a bridge between my approach with him and the program that I'm taking him to. In this way, I think it's more likely that once he's seen the program, he'll have a little bit more comfort and consider the possibility of enrolling in that program.